So, if you run a home health agency, you know exactly what I'm talking about. That constant pressure of compliance, the mountains of paperwork, that feeling that you're spending way more time on admin than you are on actual care. And look, it's not just in your head. It's a massive, multi-billion-dollar problem that's draining the whole industry. Yeah, $39 billion. That's what U.S. healthcare providers are spending every single year on administrative, non-clinical compliance work. And let's be clear, that's not money going to patient care. Nope, that's the cost of just managing the rules around the care. It's just a huge weight on the entire system. You can really think of it like a tax, right? A compliance tax that's sucking away your most precious resources, your team's time, your budget, and yeah, their morale. It just slows everything down. But here's the thing. What if there was a better way?
Okay, so first, let's just dig into the size of this thing. Let's call it what it is, a compliance crisis. And if you're in home health, this is going to sound, well, a little too familiar.
So, how bad is it? Try this number on for size. 629. That's how many different federal regulations a typical home health agency has to deal with. It's not just a couple of big rules, it's a whole mountain of tiny little requirements. And honestly, every single one is just waiting to trip you up. And you see this complexity every single day, right? You're trying to keep the federal conditions of participation straight, then you've got your own state's rules, billing codes that seem to change every other week. It's just a mess. So it's really no wonder that more than a third of agencies say that just keeping up with all of it is one of their biggest headaches. But you know, that $39 billion, that's just scratching the surface. The real price, the hidden cost, hits you where it hurts the most, your people. Get ready for this one. 79%. That is the turnover rate for home health aides. It's crushing. And it makes sense, right? When your best people are just drowning in paperwork, trying to figure out confusing policies, they burn out fast. And that's 79% turnover. It's not just a pain to deal with from a staffing perspective, it is a straight-up budget breaker. I mean, think about it. The cost to replace, rehire, and retrain all those people can hit over $400,000 a year for just one agency. That is the financial gut punch that comes from all this administrative overload.
Okay, so we've laid out the problem. It's crazy expensive, it's way too complex, and it's burning out your team. So now let's talk about the solution. Because there's a proven technology out there that hits this problem head on, but for some reason, almost nobody's using it.
Right now, if you look at the healthcare space, only about 30% of providers are using any kind of AI. That means a whopping 70% of the industry is basically trying to solve a 21st century problem with old school methods. There is a huge opportunity just sitting right there. So what about that 30%? The ones who've actually jumped in? Well, the results are pretty amazing. A massive 83% of them say it's reduced their workloads, and 37% report a jump in productivity. The proof is right there in the numbers. This stuff works. And that's where a solution that is built specifically for this problem comes in. It's called the Square Biz Docs Pocket Consultant. So what makes this different from, just a generic chatbot? Well, for starters, it's trained on your stuff, your policies, your handbooks, your procedures. It becomes an expert on the way you do business. It's all about compliance, so it can give you instant answers on billing or policies. And this is huge. It's always up to date because it can search the web for the latest CMS and state rule changes. And maybe most important of all, it's completely non-clinical. So there is zero, and I mean zero, risk to patient data. And you're probably thinking, this sounds complicated to set up. Nope, it's incredibly simple. You just securely upload your documents, the AI does its thing, and becomes your expert consultant. And then you just start asking it questions. The whole thing is up and running in less than 24 hours. No IT department needed, no big project. All right, so how does a specialized tool like this really stack up against some of the other generic options out there? Well, when you lay it all out, the choice gets pretty obvious, pretty fast. See, the generic tools, they just don't get the home health business. The ones that charge per user, that gets really expensive really quickly. And those giant enterprise systems, I mean, come on, they're usually way too expensive for most agencies. The Pocket Consultant is the only one here that's actually built for home health, and it comes at a simple, flat cost. No surprises. Okay, let's tie all this together. We've talked about the problem, we've seen the opportunity, and we've looked at a real solution. But what does this all actually mean for you and for your team, like on a Tuesday afternoon?
This brings us back to another really powerful number, 30%. That's how much of the administrative work for both nurses and for you that AI can automate. Just picture that. A third of the paperwork, a third of the searching for answers, just gone.
I mean, really think about what that feels like. That means you start chipping away at that awful 79% turnover rate because your staff isn't so burnt out. It means you're cutting way down on those expensive compliance mistakes because everyone has the right answer right away. It means one of your aides can ask a question at 10 o'clock on a Saturday night and get an instant, correct answer that's based on your agency's rules.
So, I'll just leave you with this question. What would you do with that time back? What could your team accomplish if they weren't buried under all those administrative tasks? More time with patients? Better training? Or maybe, just maybe, the simple feeling of going home on time, knowing that compliance is finally under control? What could you do with 30% of your day back?